Hi, my name is Mary, and I'm going to document with you my journey with transcranial magnetic stimulation administered by my local veterans office. A little bit about me. I'm 37 years old and have been diagnosed with depression and generalized anxiety disorder since 2003. Upon my separation of the United States Air Force, I was also diagnosed with PTSD and military sexual trauma from a deployment in Bahrain. It is believed that the events of my military career flared up residual PTSD that I had experienced in my childhood, further affecting my anxiety and depression. These events have attributed to my dependency on antidepressants. Though my initial diagnosis for generalized anxiety disorder and depression were not easy to distinguish, the trials and episodes I experienced with being prescribed antidepressants to antipsychotics were very difficult. I endured no less than 2 years of mood fluctuations from homicidal to suicidal to a zombie-like state. Prior to taking any medication, I was outgoing, fun-loving, thrill-seeking, and adventurous. After 2 months of starting the medications and discovering I am medicinally sensitive, it was difficult to find what was efficient for my diagnosis and my chemistry, and by this time I was no longer the same person. The pharmasphere I now lived in made me someone else entirely. I no longer took pleasure in the things I enjoyed growing up. I lost and struggled to hang on to ambition. Every day has been a constant struggle and a silent argument within me. My mind is constantly busy and paranoid, always worrisome. My sleep, my body, inside and out, head to toe, and my weight have all been impacted. This obviously took a toll on my person and those around me. Everything from my personal life to my professional life has suffered. I felt defective and noticed myself segregating from loved ones, family, and friends. I turned into my own worst enemy. This has been my struggle for almost the past 15 years. I have decided in the past couple of months to give all I can give to myself for the well-being of my vessel. This decision was pretty easy for me, thanks to a life-threatening experience I had this past October at the hands of a psychiatrist who felt she should alter the successful treatment my prior psychiatrist had just established prior to my relocation. It wasn't that she couldn't get me the treatment that previously had to be approved through a medical review board, or that I had endured the gambit of medication to rule out no other pharmaceutical or combination was working to be approved for this medication. I endured it all, and no matter how much I objected to it, she felt her option was a better option for me. After consulting with my primary care physician, I reduced the amount of medication I thought I had to rely on completely by half. Excuse me. I'm completely off my escitalopram, also known as Lexapro, for my depression and generalized anxiety disorder, and look to get off my narcotic sleeping med, Ambien. I still refill my antidepressant just in case. It's that paranoia in me that needs that safety net. Recently, I was informed about a new technology at my local VA. It's called TMS Therapy, and it is used to treat depression and other ailments with a persistent and visible difference in as little as 2 weeks. I was told I may be a possible candidate, so I did my extensive research and made the appointment for the evaluation. I was accepted. My hopes are that this will be a sustainable treatment with better results and without medication dependency. I called and made my first appointment for April 12, 2017. I hardly slept the night before due to nerves. My husband accompanied me to my appointment because we were not sure what to expect, and he did not tell me this until later, but he was certain that this would be a placebo effect treatment. He later recanted. My first appointment was a little over 2 hours long, and this is to fill out a questionnaire packet, go over any concerns with the staff, and to calibrate the chair and the magnetic coil. Nothing can fully prepare you for what this experience was truly like. I will try to be as descriptive and thorough as possible. There was a huge part of me that wanted nothing more than to take a Xanax prior, as I knew that this would soften the blow or tap and calm my nerves. This is ill-advised because this hinders and causes a delay in the brain's neurons and receptors and can prevent a person from receiving effective treatments. I knew this, but just in case, it is advised to take ibuprofen. Do not take Xanax. I did not do this for my first treatment, but I will for the next few in regards to taking the ibuprofen. The calibration of the chair took about 5 minutes. This seems minute, but really it's a huge deal because I have to sit in the same position for a minimum of 5 days a week for 6 weeks at 37 minutes of each session, enduring 3,216 pulses or taps to the head. I do get breaks on the weekends, but this is not guaranteed for some. Some require more extensive therapy. I can't imagine. Then comes the calibration of the magnetic coil. First, they cleanse the glabular area with an alcohol pad, and then they place what looks to be like an upside down adhesive thong on your forehead, and you can see that in the video. This is for alignment purposes, and it's not painful or messy upon removal. They use what reminded me of laser light levelers to align the adhesive both laterally and longitudinally through my temple region. The staff marks this in their system so that the next time I visit, I can just get in the chair. They hit the button and the chair calibrates automatically. Then they would apply the coil to my head and know the figures to calibrate it to without having to do any guesswork. The next steps definitely are not for the faint of heart, and as I said initially, I did not know what to expect. And the reason why I'm reading off of my journal entry is because I didn't want to get off track and off subject, and I wanted to be as thorough as possible for those that are following me, that wanted to know more details about the treatment. How I got to this point, I did have some events in my childhood and throughout life and through my military career, but ultimately everybody has their own story, and mental illness is pretty common. It does affect my everyday life, but I believe that I am a stronger person, and I am just trying one of the many methods out there to make myself better. I do know that I do feel better with exercise and a great diet, and I'm keeping to that routine as well. So if ultimately this TMS is not successful for me, I do still plan on weaning off all my medications and sticking to a paleo diet as well as a gym rat lifestyle. Anyhow, back to the magnetic coil. After applying the magnetic coil to my scalp, the staff ensure there is contact and firm pressure applied, which is indicated by their computer. The team places the coil on the left dorsolateral prefrontal cortex in the area which controls my right thumb. The impulse should not move your hand, other fingers, or arm. They are solely looking for that right thumb response. So as you can imagine, this is what takes the calibration up to 2 hours, which I used every minute and then some of that. For me, this ended up being a much bigger task that required a little more time and patience from everyone. I had suspected this was going to happen, but I'm glad that the team was able to get a response, albeit at a much higher calibration requiring a higher pain threshold. And this, obviously, for those that know how these medications work, I believe, and the doctor believes, that this was due to prolonged use of my antidepressants. My antidepressants had depressed the receptors and slowed the neurons needed to make my thumb move, therefore slowing any stimulation sent to the designated area. And that's exactly what they say that this treatment does, is it stimulates this area that has been asleep for so long that depression and anxiety tend to lull in the brain, and it kind of invigorates it and wakes it up and gives it more circulation. Kind of at a traumatic expense, as you'll see in the video. It's, again, not for the faint of heart. My antidepressants, I already read that part. The intensity in which they fired the magnetic field was at 120%. And I was told this was a pretty high for any patient, and that I have a pretty high pain tolerance. I'm not sure on what scale, but I'm told it's 120% is equivalent to 10 megahertz, I want to say, if that sounds accurate. Don't quote me on that. I'm not sure on what scale, but it's figured by a mathematical algorithm that was used to establish this efficacy. This is what you see and hear in the video. So the loud pop is the magnetic field going off. It's similar to an MRI machine, but it is a more focused machine that is applied to your scalp. The magnetic field response of 120% is also called the motor threshold, the minimum amount of power needed to make my thumb twitch. It wasn't that I had a high pain tolerance, because I was definitely crying in the video, but it was more the type of crying because I was pissed off at myself for going through with it. I was really pep talking myself, and then I told myself the long term is better, and the short term, I just had to deal and basically to nut the fuck up. So I sucked it up and carried on. In part, I was crying because of the pain and the disappointment about what I just got myself into. What turns out to be my low motor threshold is most patients' high motor threshold at the 120 mark. I was told that there are grown men that are only at about the 94 mark, absolute max. So for me to be at the 120, I was crying for pain reasons and for the fact that I was sitting in a chair. So once this was found, about an hour and a half later, the designated treatment spot is actually 5 centimeters to the front of the motor threshold position. And by this time, my head was absolutely pounding. Establishing the perfect position was a lot easier to endure than the actual treatment phase. I would definitely sit through hours of the calibration rather than hours of the treatment. And you'll see why. The finding my thumb taps felt like someone was taking a thick rubber band, placing it directly on my scalp, and popping me by pulling it back as far as it would go, with longer durations in between them repeatedly, which in turn made my right arm and hand jerk, and my eyes twitch. Now that the sweet spot had been established, it was time to begin my actual treatment. This is where my anxiety went through the roof. I do want to mention that I did have a nurse there to comfort me, talk to me, massage me, and change the channels to meditative channels for me. Not that I could really focus. Also, my husband was there, at times looking shocked or in disbelief, and sometimes worried. Especially when the actual treatment started, I couldn't control my crying. I have to be honest, though. The last thing I wanted was someone touching me. The actual treatment commenced, and it was hell. The doctor kept lines of communication open with me and would ask me if it was tolerable or intolerable. By this time, I'm honestly not sure if my head was sore from establishing my treatment spot, or I just could not handle how different the treatment taps felt. With tears in my eyes and a quaky voice, I asked him to kick it down a notch. This clearly means that I must work back up to the 120%. Currently, in the video that I'm going to show you is at the 120%. Later on, I'm not sure if it's in that video or if it's in a different video, he knocks me down to the 105. One of the videos, I can't remember which one it is, I don't want to really show because I wasn't really supposed to video, and they were kind of cool about it and kind of turned the other cheek. Either that or my husband was being really coy about it, but he was just being a rebel. So I'm posting the one that is not really too revealing. So my doctor said I'm currently at a 105, and the doctor did exclaim that he will try increasing it slowly in the next week or 2 weeks. He then said that there have been grown men at my threshold that have got up and walked out because they could not handle it. So I know that this threshold is probably not the norm for those who have not been on antidepressants for a long duration. Obviously, if you've not been taking any kind of antidepressant or anything that's going to affect your brain, or long-term narcotic use in the sense of medications, you shouldn't have adult experience. And they should be able to find your receptors that lead to your right thumb pretty quickly, and hopefully at a lesser duration, at a lesser motor threshold and frequency. This treatment feels like someone is taking a nail and driving it with a hammer. It reverberates in your sinuses through the roof of your mouth, and if you have amalgam fillings, which thanks to the Air Force I do, You can feel it all through there, typically through your maxilla area, your sinuses, and above your brows. The team advised me again, this would lessen with time, and by a week or two, I probably wouldn't even notice it. I'm really not sure about that because I don't think that any facility is going to sit there and tell you truthfully, okay, this is going to be a real painful experience. They didn't say anything like that, even though I had asked directly. I much would have preferred it, so I would have known what to expect at least, but I'm going to be pretty honest. In most articles I read, a lot of people were given the same information that I was and wasn't told that this was painful. When reading a lot of the reviews, you will find that it is pretty painful, and being that it's a fairly new study, a lot of people don't have the experience in dealing with this therapy yet, so they're still kind of coming along, as they have each patient, if that makes any sense. Okay, so however, the sharp pain did die out after the first 10 minutes. Then the tapping, which started to feel more like a woodpecker tapping, which is how it's often described, became apparent and pretty bearable. The worst part of the experience was the first 10 minutes, and the final leg, the final 10 minutes, those were the worst. I made it through my whole first session on the first initial treatment. I cried, I cringed, and I did hate it, but I'm looking at the bigger picture. After finishing with the treatment, the team removed the coil and removed the adhesive thong and placed my hair back to normal. The first thing I noticed was that I felt euphoric. The best way that I can describe it is after a long, good run when I can feel the blood circulating through my head, or like taking a pre-workout and that tingle in your head. I had better mental clarity accompanied with tenderness to the scalp and real shaky vision. My husband drove me home because I was feeling pretty high, and I cleaned like a mad woman. I had a lot of energy. I will be honest, which that hasn't happened as far as cleaning like a mad woman since my mom came to visit for Christmas. I can say I pick up and spot clean, but this was much different. We got home around 4:30, and I did notice a dramatic crash mentally and physically to where my husband even noticed it and commented around 7 p.m. I'm not sure if the surge in energy was caused because of my anxiety being pushed to the max. The best way I describe it is much like a container with a lid. Your body is that container, and the anxiety is the fireworks. You add fireworks and then put the lid on top. The energy has nowhere to go, so eventually the cycle fatigues the container and damages it, and that would explain my crash. I'm not sure if the energy that I had was a positive from the treatment or was the actual anxiety portion of my mental illness, basically. So I'm not sure if this was a positive result from the treatment itself or a negative result of my anxiety from enduring the treatment, but only time will tell. I plan on sticking with it, and I really have pushed myself the past couple months, and I'm not looking to change that. I want to be clear that I do love myself, and I would never or have never contemplated otherwise. I have a greater purpose. I have just always believed that the only thing constant in life is change, and it never hurts to try to be a better person or be better than the person I was yesterday. Also, it's solely my opinion that this treatment option would not exist without the help of pharmaceutical companies pushing their agendas on those suffering with mental illness. It takes a big person to identify when they're not themselves and to seek help. It takes a lot of courage and humility. I know this from experience. I feel both pharmaceutical and the TMS treatments are created by the same companies with the same interests. One hand washes the other, and both wash the face. This is my update from yesterday because my first initial treatment was on Thursday, and you'll find out why I'm doing this today. Update 4:14 at 5:11 p.m. Due to some adverse effects I began to experience roughly about 10 p.m. on 4:13 Thursday evening, I called my doctor a couple hours prior to my next appointment today, which was actually Friday, and was advised that I needed to forego treatments and call back on Monday. I was also advised that if I'm experiencing these ill effects, that I need to go to the ER and explain to the staff what it is that I'm feeling. The nurse informed me not to say that I was feeling this way because of my recent TMS treatment, because there is not enough evidence to prove the connection. However, I was not feeling any of these symptoms prior to the treatment. I thought this was bizarre, seeing as how I didn't have any of these issues until post-treatment and after my crash, but I'm still trying to keep an open mind about it. Last night at around 10 p.m., this was Thursday night, I was experiencing continued fatigue. This isn't normal fatigue. This was beyond exhaustion fatigue. That which I experienced around 7 p.m. that same evening. I had an intense headache around 9 p.m. and took an 800 ibuprofen. It dulled the intensity but did not make it go away. I did not feel like my normal cluster headaches or migraines that I'm typically treated for. Around midnight, I started getting lightheaded and really nauseous. It was like a violent nausea that I've only ever experienced from trauma like car accidents or four-wheeler incidents. But it's so violent of a nausea that you cannot throw up. Unfortunately, I did not have anything to take to help with this sensation, which is why I decided that I would go to sleep and wake up and call the doctor and find out what they said. And it hadn't subsided and it was still there. So I called the doctor and I was informed if it persists, I need to go to the ER. So prior to my treatment, I had eaten within an hour and I also ate dinner. So this, it's not an empty stomach that's causing me nausea. My rationale is that the trauma I received in the form of treatment is what caused this nausea. This morning, Friday, April 14th, I woke up still nauseous, accompanied by dizziness, a loose gut, and shaky vision. I ate breakfast and lunch as well as hydrated, and none of these symptoms have subsided. So as it stands, I will continue to monitor my symptoms and keep an open mind and keep in touch with my doctor on Monday and find out what he determined and how we should progress. If he's of the opinion that I should not continue this treatment because of the side effects I'm experiencing, because these side effects are considered rare side effects, which typically happens to me, I will continue on an alternate route with a different lifestyle as far as the paleo and being very active. It is now Saturday, and that Saturday evening actually, and I'm doing this video journal entry, and I am still having those symptoms. The nausea is still really bad. The shaky vision has subsided. I have in and out dizziness and lightheadedness, and I still have the loose gut. I'm not sure that there is anything else that would be causing these physiological problems. The only thing that I can attribute this to is my TMS treatment. However, my intentions are still on Monday to call my doctor and see if he would like to see me and to go through with another treatment. So I'm going to go ahead and post this, and I'm going to go ahead and post the quick little 2-minute video of actually what happens in there that they don't really show on their demonstration videos, obviously. And I will be honest and tell you that it really does hurt like hell. It does feel how it sounds to some. Thanks for making it through this experience with me, and I'll continue to post on any major breakthroughs with this treatment or any additional adverse reactions. I'll try to do regular posts if I continue with this about 3 weeks and upon completion. If I can't continue with the treatment and there's no significant changes, then obviously this will probably be my last entry. Be proactive in your mental health and definitely talk to someone. And thanks again for hearing me out.